This video is intended to give you knowledge and understanding about serious health issues, how to recognize the symptoms early, take action, and protect yourself before it's too late. Too often, people ignore the warning signs, only to realize when it's too late that something was wrong. Our goal at Next Level Studios is to empower you with information that could save your life or the life of someone you love. Pay close attention because what you learn today could be the difference between early detection and a medical emergency. Let's begin. It doesn't come with a lump. It doesn't show up on a routine exam. It whispers, not screams. Ovarian cancer is known as the silent killer because by the time symptoms appear, it's already spreading. It's one of the deadliest cancers for women, not because it's the most aggressive, but because it's almost always found too late. There's no reliable screening, no early test, and no obvious signs. This cancer hides deep inside the body, and for too many women, it stays hidden until it's already in stage 3 or 4. This is the truth that's not being talked about, and it's costing lives. Ovarian cancer begins in the ovaries' small organs that produce eggs and hormones. But once cancer cells form, they don't stay in one place. They spread quickly through the abdomen, attaching to nearby organs and tissue. The problem is there's no simple test to catch it. No mammogram, no pap smear, no early scan that's part of a regular checkup. Instead, the signs are vague. Bloating, back pain, fatigue, changes in appetite, frequent urination. Symptoms that seem normal, that seem unrelated, and that doctors often misdiagnose. This is what makes ovarian cancer so dangerous. It doesn't hide from tests. It hides in plain sight behind symptoms no one connects until it's too late. Ovarian cancer doesn't come with flashing red lights. It comes with symptoms that feel like everyday issues. Bloating, mild pelvic pain, feeling full quickly when eating, needing to pee more often, lower back pain. These signs are easy to ignore, easy to explain away. And even when women bring them up, they're often told it's just hormones, stress, or digestion. But those small signals, they're the early warnings, and they're being dismissed by patients and by doctors. By the time the real investigation begins, the cancer has already spread. This is how ovarian cancer hides, not just inside the body, but behind excuses. For many women, the risk is written in their DNA. Mutations in the BRCA1 and BRCA2 genes significantly raise the chances of developing ovarian cancer. These are the same genes linked to breast cancer. But while people talk about breast cancer prevention, ovarian cancer stays in the shadows. Most women don't even know they carry these mutations because genetic testing isn't routine, and family history questions are often skipped. If your mother, sister, or grandmother had ovarian or breast cancer, you may already be at risk, but the system doesn't warn you. It waits until you're sitting in a room, hearing the words, stage 4, and by then your choices are limited. Ovarian cancer often begins in the outer layer of cells on the ovaries or even in the fallopian tubes. Once those cells mutate, they begin to multiply and form tumors. But unlike other cancers, ovarian tumors don't stay contained. They spread quickly through the abdominal cavity into the uterus, bladder, stomach lining, liver, and more. And because there's space in the abdomen, they can grow silently for months, even years, without pressing on anything painful. Meanwhile, fluid starts to build in the belly. The cancer interferes with digestion, appetite, and hormone levels. And by the time you feel discomfort, it's already advanced. This isn't just a reproductive cancer. It's a whole body breakdown, fueled by silence and delay. There is no standard screening for ovarian cancer. Pap smears don't detect it. Blood tests like CA-125 can miss early stages. Ultrasounds are only used after symptoms appear. And most routine checkups don't include an internal pelvic exam unless something feels wrong. That means the system doesn't find ovarian cancer early. It waits until the cancer makes itself known. And by then, it's usually stage 3 or stage 4. Why hasn't this changed? Because ovarian cancer is underfunded, underrated, and often overlooked despite being one of the most lethal cancers for women. There's no early test because they haven't prioritized finding one. Ovarian cancer treatment isn't just aggressive, it's relentless. Most women need surgery just to confirm the diagnosis. That's followed by a full hysterectomy, removal of the ovaries, fallopian tubes, and often parts of surrounding organs. Then comes chemotherapy, sometimes radiation, sometimes more surgery. It doesn't end with remission. It often comes back. Recurrence rates are high, especially if it's diagnosed late. Each return is more resistant, more dangerous, more deadly. Treatment takes a toll on the body and mind. Hair loss, weight loss, early menopause, hormonal imbalance, infertility, and emotionally it's devastating because many women are forced to make life-changing decisions in the middle of a health crisis. Ovarian cancer doesn't just affect your body, it hits your identity. For many women, losing their ovaries or uterus feels like losing a part of who they are. It can impact how they feel in relationships, how they see themselves as women, how they think about motherhood, family, and the future. It comes with grief no one talks about, fear no one prepares you for, and isolation that most people can't understand unless they've lived it. Add the physical pain, the financial burden, and the mental fatigue, and you begin to see why this disease feels so overwhelming. But the worst part is knowing it could have been caught sooner, if only the signs were taken seriously. You don't have to wait for symptoms to take action. Know your family history. If ovarian or breast cancer runs in your family, get tested for the BRCA gene mutation. Talk to your doctor about your risk even if you feel fine. Push for pelvic exams. Ask for a CA-125 blood test if you notice unusual bloating, fatigue, or pain. And listen to your body. Track your symptoms. Don't ignore changes in your cycle, appetite, or digestion. And don't let anyone tell you it's just stress if you know something feels off. Early detection is rare, but it's not impossible. You just have to be louder than the silence. The final warning of ovarian cancer doesn't play fair. It doesn't show up on the tests you're told to trust. It doesn't wait for you to be ready. And it doesn't always give you a second chance. But it can be fought. It can be slowed. And it can be stopped if you stop ignoring the signs. The system isn't going to save you. It's going to wait, profit, and respond when it's already too late. You can't afford to stay quiet because what you don't know about your own body could cost you everything. The next episode is about another deadly disease, one that millions of men are ignoring until it's too late. Prostate cancer. Click for the next video.